Question. A 65-year-old man with a history of chronic smoking presents with hemoptysis, unintentional weight loss, and progressive shortness of breath over the past 3 months. Chest X-ray reveals a mass in the right upper lobe. Further evaluation with CT scan shows a centrally located lung mass with mediastinal lymphadenopathy. Bronchoscopy with biopsy confirms small blue cells with high nuclear to cytoplasmic ratio and positive staining for chromogranin A and synaptophysin. What is the most likely diagnosis? A. Squamous cell carcinoma. B. Small cell lung cancer. C. Adenocarcinoma of the lung. D. Large cell carcinoma. E. Carcinoid tumor. Correct answer is B. Small cell lung cancer. The patient's presentation of hemoptysis, weight loss, and a centrally located lung mass along with biopsy findings of small blue cells with high nuclear to cytoplasmic ratio and positive chromogranin A and synaptophysin staining is characteristic of small cell lung cancer, SCLC. This aggressive malignancy is strongly associated with smoking and commonly presents with mediastinal involvement and paraneoplastic syndromes such as SIAD and Cushing's syndrome. Option A. Squamous cell carcinoma. Typically presents as a central mass with keratin pearls and intercellular bridges. Option C. Adenocarcinoma of the lung. More commonly peripheral in location and positive for TTF1 and mucin stains. Option D. Large cell carcinoma. Less differentiated, peripheral tumors without neuroendocrine markers. Option E. Carcinoid tumor. A low-grade neuroendocrine tumor with fewer systemic symptoms and a more indolent course.